Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today's video about creditable coverage letters is relevant primarily to people who are 65 and older and have continued to work and have active group coverage through an employer of 20 or more through their work or a spouse's work. And the reason this is an issue is because if you're one of those people, you don't want to pay a Part D penalty when you ultimately retire and go on Part D. So what's driving the confusion is that when Part D started in 2006, it did not have an out-of-pocket max. In fact, this year, 2024, is the first year it does. That's $8,000. And next year, in 2025, it drops to $2,000. So this is just a very dramatic swing in the value of the benefits in a short period of time due to the Inflation Reduction Act. This might also apply to some people who have older retiree medical, but let's stick with the primary group of people with active group coverage 65 and over, which of course I'm one of those. So this was a very important issue to me. And I am on my husband's plan, so I'm a perfect example. My employees, Healthcare Navigation has its own group, but I stay on my husband's plan. And I came to learn that the out-of-pocket max for that plan is $8,000, just over $8,000. So quite a bit higher than $2,000, a multiple of $2,000. So let's back up for a minute and come to the same place about this awkward term, creditable coverage. And I'll read a couple of things for you. The Medicare Modernization Act, that's the act that created Part D, requires entities that offer prescription drug coverage to notify Medicare-eligible policyholders if their coverage is creditable. Creditable coverage for Medicare means that a prescription drug plan meets or exceeds Medicare's minimum standards for prescription drug coverage. This means that the plan is expected to pay at least as much as Medicare's standard prescription drug coverage on average. So I was highly motivated to find out what's going on with this because common sense suggests that a plan with an $8,000 out-of-pocket maximum could not possibly be creditable. And many people agreed with me on that score, but I won't bore you with the journey because otherwise this video would be 20 minutes long. But colleagues of mine, former colleagues of mine, were able to reach insurance experts at a very high level. And so I have good news because it looks like the government is making every effort to make sure that people in this category do not feel they have to enroll in Part D and cost the taxpayer money. So reading from my email, our Part D actuarial expert does not expect there to be a large impact to employer group drug coverage being creditable or not. He notes that CMS is allowing more flexibility in calculating the creditability of a drug plan, and he refers to 2009 methodology, which is the fourth year the Part D program was in effect, and the way Part D claims are accumulated under new plan structure is giving more flexibility in calculating creditability. So, enough about that. I think it's wise to just get a letter and save it. It might come with your open enrollment packet. It might be sent with the form the employer fills out that verifies you have the active group coverage. If you don't get it, ask for it. HR should be able to get it. If it's a smaller business, the administrative person should be able to obtain it for you. Historically, it hasn't been necessary because getting on Part D when you retire after age 65 is more of an honor system. The way you fill out the form indicating that you had creditable coverage. It's not like Part B, which is not. Nevertheless, I think it's wise, if it doesn't require much effort, to just get it. I've been casual about it up until now, but I'm not going to be casual about it, even though the Part D penalties for late enrollment are very modest compared to Part B penalties for late enrollment. So I apologize that this is not very interesting stuff, but I had no no part in creating this. And for most people, I don't know, it's hard to say. It's just created so much tumult in the marketplace, and I just wish it were more straightforward for people, but it's not. So thank you for listening. Take good care. Hope to see you soon. Bye-bye.